Noticed when I first came in that we do work with a lot of churches or a lot of religious centers. And we not only work with a lot of like churches, but we work with schools, and we also work with a homeless shelter that's here in the community as well. So as far as touching bases with community outreach and getting in there with the community, we've always been about that.
So the common theme that I see is that we belong to an organization, and our organization makes sure that we have the tools necessary to serve our population of people. And we have continuous communication amongst leadership teams that bring back the information so that we're in the know of what's going on. Forsyth County Department of Social Services, Forsyth County Health Department. So I'm on all those meetings with all those community leaders, and we're coming together, the Samaritan House, looking for, shelters for women and men, and resources. If people need food, the food banks, looking for crisis ministries if they need behavioral health crisis, partnering with Daymark and Monarch and all these community resources so that we're able to provide services to any population, to any kind of patient, regardless of ethnicity, race, their ability to pay.
It's looking for those opportunities, and I will tell you, individual humans, were very complex species, and there are just so many challenges with life and health, and as it relates to stress and otherwise, that we just as an organization cannot make the assumption that because we did something 2 years ago in a certain way that's going to be appropriate for future individuals. And so this is very complex, and I think you always have to be looking for ways to improve the services that you offer and be open to listening to your patients for input from them as well.
I think one of the most important jobs that any physician has is educating their patient, because the ability to understand your medical condition and the treatment plan and the prognosis has this huge impact on outcomes. So if you understand why taking a medicine for diabetes is important, you're more likely to be able to do that successfully. And so I think as a physician, and particularly a primary care physician who sees folks over months and years, that our job is to teach. But we also have to do it in a way that meets folks where they are. So doing it in the language that the patient speaks, and making sure that we're communicating in a way that's helpful and that results in that patient understanding, and results in a way that patient can then help us partner with them to make a plan. It is not our job to just tell folks what to do for their health. We really consider this a partnership. And so we want patients to walk out of here feeling like they have a team behind them.
So with the pharmacy, we have the privilege of, being there somewhat last stop within the system. They go check in, they see the provider, and they come see us. And a lot of times we have more time to be able to provide counseling and education. I am diabetes certified, so I'm really looking at them from a totality standpoint of their nutrition, their lifestyle modifications, and basically making sure that they're on the right regimens when it comes to their history and everything. So.
If you want to go fast, go by yourself. But if you want to go far, go with someone else, right? So something that's built into our core competency, that's built into how we move or how we run, is collaborations with other organizations in our community, right? And so we work with them to leverage some things that they do really, really well. They work with us to leverage some things that we do really, really well, like supportive housing or job preparation. So I think we do a really good job at collaborating with folks that have similar missions, but may have different core competencies or different strengths. And so that's definitely a part of our initiative to serve Winston-Salem and to serve Forsyth County.